When you check up to date, even like all the latest, it talks about how warm compresses are
warm
number
compresses,
one.
absolutely.
Number one, warm compresses.
Yeah.
And what do you do with the warm compress? What are the warm compresses people need to know? Hi everyone. Today we're talking about styes. Styes. It sounds like it rhymes. So Dr. Ayoade, take it away.
So I'm sure a lot of us have either had a stye or know somebody that's had a stye, and that's a small swelling on your eyelid. Can be very irritating, doesn't look nice, can be quite painful sometimes, and it's quite common. So what causes styes, Dr. Ekuase?
Usually, in the eye, we have all these hair follicles, and then we have oil glands and stuff. It's usually infection of the hair follicles.
Absolutely.
And a lot of people, even like older children, they come in and they have all these styes. Makeup.
Yes.
When you have makeup, you're supposed to throw away your makeup brushes and all every 3 months. Now, who does that?
Yeah, well.
I guess if you have an eyeliner, you're supposed to sharpen it every
3 months.
Because I've had some eyeliners for years.
A lot of makeup harbor bacteria.
Yes, a lot of makeup. Yeah. So if you're going to do your, especially now with all these eyelashes, yeah. So if you're going to do your makeup, just make sure that you've cleaned them the way they're supposed to be cleaned. You've sharpened the tip of your eye pencil so that removes that layer of bacteria that was used, that was probably there before you used it. And then, we just see those, and they're like little boils, and they can be extremely painful, like you said. And they're embarrassing because they wear sunglasses.
You can't hide them because they're just there right by your eyes.
Right. So there's another thing. Styes can be on the inside, just on the inside, or it can be on the outside on top. Yes. So most times when patients come, they're like, how do I get rid of this stye? It's a problem. Yeah. We want to make sure it's not a chalazion. Yeah. So we always want to find out, how long have you had this stye? Most styes, they show up within a week. By 10 days, they're gone. They're gone. Because they're very superficial. And guess what? Antibiotics don't do anything.
No. If you leave a stye, it'll go
away by itself. Yes. Yeah, the body's immune system will fight it and it will go away. Yeah. When people start doing antibiotics, sometimes it can even get more irritated.
Exactly. I think it's just the mere fact that you have this swelling on your eye and you feel you need to do something. Yeah. Even a warm compress.
When you check up to date, even like all the latest, it talks about how warm compresses are number one.
Compresses, absolutely.
Number one, warm compresses. Yeah. And what do you do with the warm compress? What are the warm compresses people need to know?
As in what?
Because I tell them, just get cotton balls.
It's just cotton buds, yeah.
Cotton balls,
and you just put it in warm
water,
and just dab it on it. That's it.
Like face towels.
Oh, okay.
So I say, well,
I know about the cotton pads,
balls. Actually. Yes, and they're disposable. Just use a disposable one so that you're not putting something on your eye and then
spreading
the germs and then putting it back when it's already getting better. So warm compresses. That's 4 or 5 times a day. That usually helps, and it will go away. Yes, and if it doesn't go away,
don't prick it. Please don't squeeze it.
That thing can be painful. Yeah. People start trying to squeeze
it. I know. Don't squeeze it. Just leave it alone.
When they try and squeeze it, it gets bigger.
Exactly, because it starts spreading. Yeah. So just leave it alone. It'll go eventually.
Go yeah. And then if it's something that is there and it's been more than 2 weeks, then it could be a chalazion. Chalazion is kind of like a collection of oil in the oil glands. And it's usually higher up. It's usually up here or down here. And
most times big, can't it?
They can be very big, and they can actually they can actually change your face.
Absolutely.
And those you need to see an ophthalmologist, because a pediatrician like us or a regular GP we don't have these facilities to drain those. So if it's been there for more than 2 weeks, see an ophthalmologist, yes, an eye doctor, not an
optician.
Not an optician for glasses, exactly. People have a difficult time knowing which is which. An eye doctor, a doctor who has gone to medical school and has specialized in eye, so they can do that surgery to remove that oil that has accumulated for whatever reason, and those are called chalazions. That's different from styes. Yep. So if you have any concerns, see your doctor. If you're here in Lagos, we're pediatric partners. Come see us in Victoria Island. We'll be happy to see you.
Absolutely.
That's why this has been so fabulous.
It has been fun. It's been great.
Our what do we call it? Show.
On our show.
Yes.
I'm happy to be part of the show.
Yes. And thank you so much. If you want to see any of us, Dr. Ayoade or I, we're at Pediatric Partners. We'll be very delighted to see you. Yes, thank you.
Absolutely. Thank you.
And we'll see you soon.
All right. Goodbye.
All right. Thank you, Dr. Ayoade.
Thank you.
Okay. Bye-bye.